Plasmodium species is the causative agent of malaria, and malaria is considered as it has the most mortality rate of all the parasitic infection worldwide. And in the Philippines, please take note, the most common Plasmodium species is your Plasmodium falciparum. And for the rest of the world, the most common is the vivax. The infective stage of your falciparum to man is your sporozoite, okay, and to mosquito, gametocyte. Pathology, it could cause recurrent fever, meaning there is a repeated or a cycle of fever, no? Fever, tapos gagaling, tapos fever again, chills, and sweating. It could cause anemia because of the rupture of RBCs, di ba? Splenomegaly because the ruptured RBCs go to spleen, no? Yung kanilang graveyard. So, pag maraming namatay, mamamaga yung spleen. And joint pain as well. Okay? So, unfortunately, kung ano yung nasa Pilipinas, that is the most fatal kind of malaria, no? Because the falciparum could, in chronic stages, could cause also the cerebral, no, malaria and black water fever as well. Black water, tulad nung kanina, nangingitim, no, yung balat and yung kanyang urine because of severe RBC rupture. Though we have the certain blood groups and conditions that are resistant to malaria, the Duffy, the MN, G6PD deficiency, and the sickle cell anemia. The common denominator of these four is the morphological nature of their RBC, no? Yung kasing mga malaria, ang hinahanap ng mga yan, the Plasmodium species, rather, yung hinahanap ng mga schizont is, or yung mga sporozoite, ang hinahanap nila is normal morphological nature ng mga cells. And unfortunately, of these four conditions, abnormal yung morphology ng kanilang cells. Okay? So, schizogony, repeat lang natin. Ayan, this is another names, no, for their stages. Although, same lang naman. Yung ginawa ko kanina, that is the CDC. No? So, pare-pareho lang naman yan. So, ayan. Pinasimplify. Number 1, sporozoite. Nagiging cryptozoite. And then, merozoite. Cryptozoite and merozoite, yan yung schizont. And then, na-ruptured yung schizont. Ring trophozoite, yan yung immature trophozoite. Schizont. Naging mature trophozoite into schizont. Merozoites, yan yung release ng ruptured schizont. And then gametocyte, which is the micro gametocyte and the macro yung isa, no? Sorry. Sulat natin. The macro gametocyte. The sporogony, on the other hand, we have the mature microgametocyte and the macrogametocyte. And then the gametes magiging zygote. The zygote is the ookinete, no? Pareho lang yan. Then oocysts, tapos ma-rupture yung oocyst, lalabas yung sporozoites. So ayan yung differences of their plasmodium between the plasmodium species. Among the plasmodium species. So for their recurrency ng fever, chills, and sweating, sa Plasmodium vivax, we have the 48, so benign tertian malaria. Plasmodium malaria, quartan malaria, 72 hours. Falciparum malignant tertian malaria, 36 to 48 hour cycle. Plasmodium ovale, the tertian malaria, 48 hour cycle. Plasmodium knowlesi, or the simian malaria, 24 hour cycle. Yung makikita nyong dots or stipplings, those are the ring stages, no? ng ating malaria, which can be used as a diagnosis for them. Okay? Yan yung makikita, yan yung tinitignan or yung hinahanap sa thin and thick smear to diagnose the presence of malaria. In Vivax, we have S, or the Schuffner's dots, no? BS. Please remember that. Malaria and Knowlesi, on the other hand, they don't have stipplings. So, tandaan nyo lang, Vivax and S. So, Vivax Schuffner's. Falciparum is Maurer's. So, FM, VS, FM, and OS, Ovale and Schuffner's. So, Ovale and Vivax, Schuffner's, Falciparum Maurer's, Malaria and Knowlesi, they don't have stipplings. Okay? So, another species of parasite in under the sporozoans are the Babesia. Other books, Babesia. So in healthy individuals, they could only cause a small headache and a fever. And however, for immunocompromised individuals, they could cause hemolytic anemia as well as hemoglobinuria, because the same goes with your Plasmodium species, they could also rupture RBC. The definitive host are deer, and the accidental host is man. The intermediate host and the vector is the deer tick of the Ixodes species. The mode of transmission is a bite wound, or pag nakagat ka ng Ixodes tick, ng deer tick, or, the importante, no? You could also be infected by your Babesia using the blood transfusion. Okay? The last one under the coccidians is yung tinatawag nating, under the apicomplexa, yung mga tinatawag nating coccidians. In this example, ang papakita ko lang is si Isospora belli, or in other books, they call them Cyclospora belli. So the first thing is we have a stool. Lagyan natin brown. Ay, wala palang brown. Okay, sige. Yan. Yan, ganda ng drawing ko, ano. Yan. So in stool, what are we going to find? An oocyst. So yan yung pinakaunang stage, no? Oocyst in stool. So this is your diagnostic stage. And from oocyst, it will transform into your immature oocyte. Ang itsura niyan ganyan. Madali lang i-drawing yung mga yan. Immature oocyte. Ito yung tatandaan nyo, no? Immature oocyte with, meron yang sporoblast. Yan. Ano yun yung nasa loob. Sporoblast yun. Next, immature oocyte would then transform into their next stage, which is your mature oocyte. However, instead of the sporoblast, magiging na siyang sporocyst. Tatandaan niyo yan, ha? So, oocyst, immature oocyst, pero may sporoblast. Mature oocytes into mature oocyst with sporocyst. Lahat to nangyayari sa stool, no? Nangyayari yan lahat sa stool. Okay. Next, ano mangyayari? May ingest yung mature oocyst ng human. Yan, ganda ng drawing ko. Yan. May ingest niya yung mature oocyst, and then the oocyst would go to their asexual stage. So, yung oocyst mo, magiging sporozoites, and then magiging siyang merozoites. Clue, fun fact, katulad lang ng kay sporozoans kanina, no? Kay apicomplex sa nagiging silang schizones, no? Merozoite din. And then from merozoites, kaya lang ito diretso, hindi siya hiwalay na stage. Merozoites, it will go into their sexual stage in yan, micro and macro gametocytes. And then, lalabas na sa stool, magiging oocyst ulit. No? Ganun lang kasimple. So, apicomplexa coccygians under the phylum Apicomplexa. Once again, they also have the schizogony and the sporogony. Schizogony meaning the asexual reproduction, and sporogony the sexual reproduction, which involves your micro and macro gametocytes. Sa schizogony, involves sporozoites and your merozoites. So, the infective stage to the humans is the ingestion ng oocyst. Anong klaseng oocyst? Mature oocyst with sporozoites. No? Commonly infects immunocompromised individuals, which are yung mga people with AIDS, geriatric patients, or the old people, as well as pediatric patients, or yung mga infants and young. No? Another coccygian is yung Toxoplasma Gondii. No? So, the Toxoplasma Gondii is the most common parasite in developed countries. Healthy individuals seem to be asymptomatic lang, or they are carrier. However, for immunocompromised individuals, they could cause flu-like symptoms. And please take note of this is very important. Toxoplasma gondii could cause a transplacental infection, meaning if a pregnant woman is infected with Toxoplasma gondii, the Toxoplasma gondii could be transported to their fetus, no, and could cause the fetal death. No? The definitive host of your Toxoplasma gondii is the cats. No? And under the cats, doon nagaganap yung asexual, the sexual stages, yung sporogony. In the intermediate host naman, doon nagaganap yung asexual naman, or the schizogony. And tatandaan nyo lang yan, sporogony, sexual, schizogony, asexual. The infective stage to the intermediate host, which is man, is same lang, oocyst in feces. Anong klaseng oocyst? Oocyst with sporozoites. Please remember that. No? They have two types of sporozoites. We have the tachyzoites and bradyzoites. So, madali lang tandaan yan. Tachy, mabilis, and brady, mabagal. Tachy is the active dahil mabilis. It is the dividing form, and the bradyzoites, mabagal, it is inactive. Meaning, the tachyzoites are the one responsible for asexual reproduction, while the bradyzoites will wait in their form bago sila maging tachyzoids, and dun sila pwedeng makapag-asexual reproduce. Next is the Isosporabelli. Definitive host is man, and sa man, nagaganap yung both the schizogony and the sporogony. The mode of transmission is sporulated oocyst in food or water. So instead of a normal oocyst, no, kailangan yung sporulated oocyst. The next is the Cryptosporidium, pwedeng parvum and other species. No? Any other species lang naman to. Cryptosporidium species, they could cause diarrhea in AIDS patients. nursery schools, and waterborne. Okay, this is waterborne. Ibig sabihin, they can found in water. Definitive host is man, and the man, doon nagaganap ang both the asexual and sexual reproduction. The mode of transmission is oocyst in water. And that's it, no? For all of the protozoan parasites. If you have questions, you can use the discussion forum under the parasitology module of our Canvas. Or you can email me at my end. Kung ano yung nakikita nyo dyan. samuharansiron@auf.edu.ph. And if you have also questions na regarding parasitology, kahit hindi siya tungkol sa protozoan, yan, you can email me then. No? I can give you the whole handout of the buong parasitology if you need it. Okay? And on that note, thank you. And syempre, yan, pagdodrawing ko kayo kasi yan, sana na-appreciate yun yung mga drawing ko sa life cycle. Pagdodrawing ko kayo ng sino ba yung maganda? Yan, ang ng pasyente. Yan, Squidward. Tapos naka-finger heart siya. Wait lang. Yan. Okay? So, thank you. Hopefully, nakinig kayo. And if you have questions, no, don't hesitate to ask. God bless. Ingat.